Let's do a quick overview of the medical plans. There are 4 medical plan options. One of those options, Active Care 2, is not open to new enrollments. It can only be chosen by someone who is already enrolled in that plan. So we'll put that one to the side as we compare the other plans. All of the plans are through Blue Cross Blue Shield. They're listed here in order from the plan with the lowest monthly premium to the highest. Let's touch on the highlights of each plan. First up, the deductible. The primary plan has a mid-range deductible. The HD plan has a high deductible, which also makes this plan eligible for a health savings account, which we'll talk about in another video. The Primary Plus plan has a lower deductible than the other plans. 2 of the plans have copays for when you see a doctor, Primary and Primary Plus. These plans also direct care through a primary care physician, or PCP, and you must get referrals to see specialists. While these plans aren't HMOs, some doctors consider them like HMOs because of the need for PCP referrals, and not all doctors accept these plans. But having a PCP definitely has its benefits. You'll have a medical professional who'll get to know you and your unique health needs. The Primary and Primary Plus plans also use a statewide network of doctors and hospitals, and there is no out-of-network coverage except in the event of an emergency. However, there is an exception. If you have kids away at college in another state, then these plans can be expanded to cover them. And of course, virtual health care can be accessed from anywhere. The HD plan does not require you to select a PCP or get referrals to see specialists. It uses a nationwide network of doctors and hospitals and does allow coverage at out-of-network providers, but at a lower level of coverage. One other thing to note. On the Primary and HD plans, the deductible must be met first before other types of services are covered. On the primary plan, you have the copays for office visits to your doctor, so the deductible doesn't apply there, but it does apply to any other medical services you receive, and it applies for prescriptions as well. On the HD plan, the deductible has to be met on all services, including doctor's visits and prescriptions. Now, there's one exception to having to meet the deductible. All of the plans include free preventive care, like your annual checkups, immunizations, and age-appropriate screenings. You don't have to meet the deductible first. WellCare is covered 100% when you use an in-network primary doctor. And all the plans include programs to support a healthy pregnancy, fitness, nutrition, and weight loss goals, and so much more. Now, everyone's big question is, which plan should I choose? Well, no one can answer that question except you. Just like any other major purchase, you'll do some comparison shopping. What's the most important feature to you? Is it prescriptions, copays, the network of doctors? Whatever it is, compare that feature on all the plans, and then consider it in context with the whole plan, including the premiums that you'd be paying. Now, that does require some legwork, so start your research early. Check with your doctors and pharmacy. You can also call a personal health guide with Blue Cross Blue Shield to ask any detailed questions about how certain procedures or prescriptions are covered on each of the plans. It's well worth it to know that you've made an informed decision. And always, always double-check the list of network doctors. If you have a particular doctor that you absolutely have to have, check the network for each specific plan before you make your choice. Those are just the highlights, but there's so much more to know about these plans. Please visit our website, pisd.edu/benefits, to review more details about the coverage, additional programs, and services.